Hi, Stacey. Thanks for joining us today. I'm glad you had time that we can chat about a concept that you raised to me that I thought was quite interesting. It's called behave calmly, not calm down, but behave calmly. I'm just wondering if you could elaborate on how you came up with that concept and how you think it benefits your clients.
So I can't really say that I came up with it. Honestly, the material that we share online focuses on behavioral change. That's what we do, right? Yeah. And this is just really more of an affirmation of the same. I've just found that when clients focus on rather on how they're behaving rather than trying to create an experience or a feeling, they often find that that's more achievable, more doable. That isn't to say that, behaving calmly comes easily.
Yeah.
Requires that we develop what I call an objective perspective of self-awareness. Where you're reviewing yourself in a more objective way regarding how you're responding to symptoms, situations, circumstances, or events. Those of us who are struggling with anxiety disorder, we're often really good at inward focused thinking and self-scanning. So I don't want that to be confused with being self-aware. That's not what I mean by being self-aware. Mm-hmm. Being self-aware means paying attention to how you're behaving in response to those situations, symptoms, circumstances, and events.
Right. Mm-hmm. And how have you found that approach working with your clients? Like, do they respond to that better than, calm down? I mean, that's what we say all the time, calm down, right? Like, calm down this, calm down that. But you raise a good point. Well, if a person doesn't feel calm, are they actually calming down? So behaving calmly would make more sense to them rather than just calm down.
Yeah, so first of all, let's define what I mean by behaving calmly or behave calmly. So I define it as choosing to intentionally respond. So it's intentional. It's not reactive, it's responsive.
Right,
so choosing to intentionally respond to a situation, circumstance, symptom, or event with calm, passive acceptance. I have a client that I graduated some time ago, and I actually asked him, because I knew you'd be asking this question, what kind of impact this has with the clients. And this is what he said when I asked him about behaving calmly. He said this. He said, today, when I experience a stressful situation, circumstance, symptom, or event, I don't go into telling myself to just calm down. Now I observe my behavior and the physiological response of my body to the stressor. I am now able to objectively evaluate a situation and behave calmly rather than responding apprehensively like I used to do. I am able to recognize when I am talking faster or overanalyzing, and I choose to behave calmly and respond neutrally. I am now able to objectively evaluate a situation and respond accordingly and avoid further stimulating myself. And then he gave an example. He said, for example, just last night, we had a water main break at my place of work. So he works at a major coal-fired plant. He said, I received this call about the situation, and even though it was very stressful, I was able to remain focused on behaving calmly in response to this situation and not worry about making myself feel calm. Rather than insisting I stay calm over and over and over again, I willfully responded to the situation in a calm manner and just dealt with it. So even though it was a very stressful situation, very stimulating situation, it did not have the same emotional impact on me like it would have in the past.
Ooh, yeah, right. Wow.
So that's a really good sort of personal example. And yeah, this person also obsessed a lot about other things like blood pressure, and so now even, he doesn't worry about that anymore. He knows that's apprehensive behavior to worry about things like that. So yeah, I just have found that giving people the ability to focus on a behavior is a lot more achievable than trying to create a feeling.
Right. Yes.
We are both well aware that, right, the emotion of fear is compelling. It's almost overwhelming in some cases, right? So when we contain, sometimes I think clients get this idea that, and not that we suggest this to them, but they get the idea that when they practice the strategies that we teach them, that they're going to feel a response.
Yes, right. Yes.
Right away. Now, eventually they will, but in the beginning, the emotional response from containment is never going to be as obvious or as profound as our fear.
Yes. Yeah.
Right. So it's really about practicing that behavior so that ultimately over time, the response of the body will be quicker to the situation, and we're not adding fuel to the fire. So I have a little saying I say to people. I always say, fear is instinctual. Confidence is intentional.
Yeah, I like that.
So,
And you make a good point where, the response to danger is pretty profound. And so it takes a lot of work, which is kind of anti-fear response when you think about it, because the body wants you to move and get out of there. But yet we're saying, no, I'm not going to react to that strong feeling. So I see what you're saying by behaving calmly, even though you may not feel calm, your body is still going to respond because you're actually implementing the behavior. And then, of course, over time, that's when your body will start to calm down. Correct?
That's correct. And, we actually talk a little bit about this, I've talked a lot about this with clients. If you think about professional, people who are professionals, firefighters, police officers, doctors, nurses, they're taught to behave calmly despite whatever the engaging circumstances are that they're being exposed to in the moment.
Yeah.
And so the situation that they experience, whether it's a fire or an emergency or some really horrific thing that they have to come across, despite how stimulating that experience is for them, they've taught themselves to remain calm, to behave calmly in response. Now, unfortunately, we all know that a lot of times after we've been traumatized by something, even if we are taught to behave calmly, there needs to be even for the professionals, we need to have an outlet. We need to have something, a way to talk about it. We talk about how people will talk about their trauma or their experience. So in the moment, they're good, they can handle it. But then sometimes if they don't process that later on, then that's not healthy either. So they have to be able to talk to somebody, talk it out. But it is the point, I guess, we want to make to everybody is that, hey, despite how compelling the fear is, you're always in control of your behavior, period.
Yeah, totally. Yeah. Hence the behave calmly, despite how you feel, behave calmly, and you'll achieve that goal in time. Yeah. Awesome. Well, did you have any other final comments you wanted to leave with our viewers before we wrap?
So I'll just say this, that the ability to behave calmly is a choice that we can make every time we're exposed to such a situation, circumstance, symptom, or event. And if we work at behaving calmly every time, then over time, we will actually begin to feel calm quicker. Yeah. In fact, when we get really good at behaving calmly, experiencing a feeling of calm will happen more quickly down the road. We actually start controlling how we behave, not necessarily how we're going to feel in those present moments. So, I guess I don't want to disqualify the emotion that we feel in these moments. Our emotions, as I always say to people, are genuine reflections of what we say to ourselves about something. Mm-hmm. So if we can gain confidence in our behavioral response, in other words, in what we say to ourselves about a situation, that's going to have a more positive emotional impact on us. And that situation that we're being exposed to or symptom or event will eventually de-escalate more quickly in the future. So I hope that makes sense.
Mm-hmm. Yeah, totally does. Yeah. And I like the analogy you made about, emergency workers, they are taught to override their initial reaction of danger by putting their cognitive abilities in control so they can be in more control. So, and all of us have access to that, just some out of practice, correct?
Absolutely. We talk a lot about, when I say we, I always say we because I see us as a team. And so I'm assuming we're all talking about the same thing.
I hope so.
I see, right? But one of the things that I like to share with my clients, and I know that you've talked about this too, is I believe that there is a difference between our mind and our brain. Yeah. I believe that our brain is the little organ in our head that has instinctual, fear responses. We talk about the emotional brain and the rational brain, but I always try to let people know, hey, your mind is always in charge. Your mind is your will, your ability to always choose. And if you can remind yourself that no matter how compelling my emotions are or my feelings are, or what my brain is trying to tell me is dangerous, I can always override that. I can always veto what my brain is compelling me to do.
Yeah.
Right. And we know that the mind always teaches the brain or changes the brain, not the other way around. The brain can only compel.
Yeah.
That's all the brain can do. It can't control me. Right.
Yeah.
My mind controls me. So yeah, here's a great example of mind over matter. That, by the way, that's a true thing, right? Mind over matter.
Yeah.
Remember when we were kids and we were growing up and our moms or dads were trying to talk to us and it didn't matter what they'd say, we would just willfully block them out.
Yes.
So even if we're getting yelled, we have the ability to be like, what? I didn't hear anything you said, right?
Yeah, exactly. Yeah.
So we do have strong will, the ability to choose no matter what, despite the circumstances.
Yeah. And speaking of will's like a muscle. We have to practice that to engage that mind over matter. So there's another area that people can grow in is in developing strength and discipline and willpower. Would you agree?
I agree 100%. Yeah. I think that, if there's anything anxiety has taught me a lot. I'm sure it's taught you a lot too, Jim, about yourself and about life and how you deal with things. And some of those things are always going to be a problem probably because, hopefully less so as we get better at addressing them. But my anxiety has taught me that I had a warped understanding of control. It's taught me that the only thing I control is me.
Yeah.
I don't control necessarily how my body reacts to stimuli. It's instinctual quite often. But what I control is how I respond to that stimuli, how I respond to my body's response.
Yeah.
So layers upon layers. And I've just decided, hey, when, every time a situation comes up, I go right into, okay, how am I going to respond to this? I have two choices. I can freak out or I can objectify it. I can rationalize. And there's a lot of stuff going on in our world right now where I think a lot of people, we all need to work on focusing on controlling our behavior and not letting emotion influence those choices.
Yeah, totally. Yeah, especially today. Yeah, it was funny you mentioned that because years ago, I remember coming to that conclusion. I remember saying to myself, I don't know much at all, and I'm not in control of very much at all. It was kind of eye-opening for me because after all these years, you just think that you have control and, you understand all these things. Then you get to that point when you realize just how little external control you have. So that was pretty good pretty big for me.
Well, and this is interesting too. Boy, you're opening up interesting conversation here. We may want to have it to be continued at some point down the road.
Sure. Yeah, you bet.
I found that in my experience, I don't know what your experience has been like with our clients, but I found in my experience that there are generally two types of clients. This has just been my experience. One are those who have been through horrible traumas, difficult upbringings, lots of issues that they need to work through. And those are clients that, require quite a bit of time to process that stuff. It doesn't happen overnight. And anybody who promises that they can cure them overnight is forthright or wrong.
Totally.
Does them a disservice. Then on the other side, the other client are those who have had in their mind the perfect life. They've not really had any issues in their life. They had great parents as far as they're concerned. Their upbringing was good. And then, and they've learned to work really, really hard, like too hard. And they overdo it and they ignore all the warning signs that the body's trying to tell them you're pushing. And they just keep pushing through, white knuckling it through the days. And then all of a sudden something happens, a death in the family, a job loss, some form of crisis that they couldn't possibly anticipate. And their body just says, you know what, that's enough. I'm done. And at that point, they what I say, breach their stress threshold. And they have a panic attack or they experience some disturbing symptom like depersonalization. And they're not capable of containing because they've never really had to.
Right. Yeah.
Everything's been fine. And they don't understand. It's like, how do I live my whole life feeling totally fine? And then all of a sudden now I'm here.
Yeah.
Those are the two types of clients that I feel I've worked with, either the very traumatized or those who didn't have the tools.
That's right. Sort of got by in life without having to use them, and then all of a sudden,
They just kind of like, everything was good. It's like, I got a great mom, dad, everything was great. I don't understand what's going on. I'm like, frankly, you've never had to deal with anything like this.
yeah.
So you didn't know. I mean, it's not your fault. It's just, how would you know?
Yeah, exactly. And we should carry on this conversation. I know we're probably getting close to the end of our time. So did you have any final comments before we break today?
No, I just think remind people, recovery is possible. If you know that, if you have the right information, if you do the work, if you're patient with yourself, you can't rush your body. You can't make it heal any faster than it's capable of healing. And just work the program and trust your therapist. And if you're not seeing one, we urge you to see somebody. Have therapists that are currently open at this point. And that's all. Just, and if you're not a member of the website, be a member. The information on there, Jim, I know you put a lot of time and effort into there, and it's like an online encyclopedia for anxiety. So if you're not a member, at least get a membership and see what it's like.
Awesome. Stacey, thanks so much again for taking time out of your Saturday, out of your leisure time. I appreciate the opportunity to speak with you about this and look forward to further conversations.